I'm Dr. Doug Bartles, an orthopedic surgeon and sports medicine physician with Mayo Clinic Health System. I'm here to answer questions about our sports medicine department, the types of injuries we treat, and how we can help prevent those injuries from happening in the first place. Yeah, that one is really tough, and we work hand in hand with our family medicine providers in terms of them educating us on what's coming into clinic and us trying to educate them about things that may need to be escalated to see a sports medicine provider, either one of our non-operative specialists or one of our surgeons like myself. And that can be really challenging for patients. So it's never, if you have a question about it, it's never a bad idea to go to your family medicine provider first. And they do a really good job of directing either to, something that they're able to manage and treat versus kind of referring it if it's more of a high acuity thing to someone that specializes in sports medicine. At the end of the day, if you wanted to make an appointment with one of us in the sports medicine world, though, that's perfectly fine. We really see everything. We try and make it a comprehensive sports medicine experience. So we, on our team, we have non-operative family medicine, sports-trained physicians. We've got non-operative, former surgeons that deal with sports-related injuries, and we have our sports medicine surgeries, including myself. In addition to the actual doctors that are treating patients, we've got a team of athletic trainers, physical therapists, occupational therapists, medical assistants. So we try and make it a one-stop shop for all of your orthopedic needs, whether that's fitting you for a brace or a sling, getting you set up in therapy, injections. We try and make it so everything that you could need from a sports medicine standpoint, we can take care of. Yeah, I think a huge part of sports medicine is actually the preventative side of things. So even evaluating people that are going into sports from a young age and just getting a general assessment of, where they're at in terms of kind of overall muscle imbalances and the strategies that we can use to kind of address those before they begin athletics is huge in terms of actually preventing injuries. So, we treat a lot of people that have sustained injuries, but even seeking the evaluation of a sports medicine provider before it becomes an issue can go a long way. We can see adolescents, absolutely. Most people that are going into at least any sort of organized sports will have a pre-participation physical. That doesn't always necessarily have to be with a sports medicine provider, but we certainly can provide those. And then we oftentimes will do kind of pre-participation physicals for specifically the orthopedic side of things as well before people start their soccer or football or baseball seasons too. To learn more, please click on one of the links on the screen or in the description below.